My name is Nandini Nair. I'm Professor of Medicine, Division of Cardiology at Texas Tech Health Sciences Center in Lubbock, Texas. I just presented a paper on thrombolytics and non-thrombolytic therapies in VAD management, and the idea is that should we have a tailored approach, and we did a lot of literature search at this point and meta-analysis which shows no difference between the surgical therapies and the medical therapies. We therefore concluded that at this point it is better to do the treatments on a case-by-case basis and tailor the therapies depending upon the patient's clinical status and equity. At this point, there is a lot of controversy on what therapy is useful. The heterogeneity of the populations and the studies have proved it difficult for us to pinpoint defined therapies. We also have changes and differences in therapies offered at different centers. So we did a meta-analysis comparing 70 studies, of which 15 studies were chosen, and these studies showed that there was no difference in the surgical versus medical therapies. This meta-analysis is limited by the fact that there is a lot of heterogeneity not only in the study populations but also in the treatment modalities, in the medical treatments as well as the surgical treatments, and some crossover studies. Therefore, we need randomized controlled studies at this point to have a better definition of standardized therapies for pump thrombosis management.